Hemophilia C, also known as Rosenthal syndrome. This condition was discovered and named by Robert Rosenthal. In 1953, two sisters came in for dental extractions and tonsillectomy. Afterwards, they presented with abnormal prolonged bleeding. Originally, this condition was called PTA, which stands for plasma thromboplastin antecedent. However, in 1961, the International Committee for Nomenclature of Blood Clotting Factors changed it to factor 11 deficiency. This was in order to help distinguish it from hemophilias A and B. This can occur in anybody of any ethnicity or race, but it's primarily linked to the Ashkenazi Jews, which represent 50% of cases. It's a more rare form of hemophilia, with an occurrence of 1 in a million. However, for the Ashkenazi, this number is closer to 1 in 11 when heterozygous and 1 in 450 when homozygous. It can be autosomal dominant or recessive. When recessive, it results in a more severe form, and this is commonly seen in the Ashkenazi due to inbreeding. In the dominant form, only one copy of the gene is needed, and the resulting bleeding is more mild to moderate. There are no gender distinctions and will affect men and women the same. And there are 3 different point mutations that account for almost all cases. These are found on chromosome 4. And in the image above, to the far right, you can see the location of the factor 11 gene marked with a red line. Some other conditions associated with mutations on this chromosome include Huntington disease, Parkinson's disease, and narcolepsy. Hemophilia C can also be acquired as an immunologic response or as a result of conditions such as SLE and Noonan syndrome, which create inhibitors of factor 11. It can also be acquired from severe liver disease or a liver transplant. Factor 11 is produced in the liver, and it is a serine protease of the intrinsic pathway. It acts as an activator of factor 9 to produce more thrombin. Unlike hemophilias A and B, hemophilia C does not show spontaneous bleeding. Instead, it will show prolonged bleeding with major physical traumas. It is also not very common to see bleeding into the skull cavity or into the joints or muscles. You will frequently see nosebleeds and bruising, and it will be more mild to moderate bleeding. The tendency to bleed is not proportional to levels of factor 11. This means that the amount of factor 11 in the patient's plasma doesn't necessarily correspond to the degree of bleeding they may show. Testing and lab results associated with this condition include a prolonged PTT, a normal PT, and a normal TT, the factor 11 assays done to help confirm a diagnosis. Treatments include plasma infusions of fresh frozen plasma. Fibrin glue may be used during surgeries to help stop the bleeding. Other antifibrinolytics can be used and are usually used more to protect the mucous membranes. A more unconventional treatment is hypnotherapy. This has been used as a means of relaxing a patient before surgery and has shown some decreased tendency to bleed during and after surgery. One option that I did not include on the list is the factor 11 concentrate. These are not approved for use in the United States. That ends my presentation.